Hi everyone, welcome to my YouTube channel My Health and Me byfun. Please like, subscribe and share. Tetanus affects the nervous system, leading to painful muscle contractions. These contractions can be so strong that they can even cause bones to break. A common name for tetanus is lockjaw. This name comes from the way it can lock up the jaw muscles. Tetanus is caused by a bacteria called Clostridium tetani. These bacteria release a toxin, a kind of poison that disrupts the nervous system and causes the muscle spasms. You might have heard that rusty nails cause tetanus. While it is true that stepping on a rusty nail can lead to tetanus, it is not the rust itself that is the problem. It is the bacteria, Clostridium tetani, which are everywhere in the environment. They live in soil, dust, and even in the intestines of animals and humans. Rust does not cause tetanus, but rusty objects are often found outdoors where these bacteria thrive. Tetanus bacteria need a way into our bodies to cause infection. They cannot get in through intact skin. They enter through cuts and wounds. Even small cuts or scrapes can provide an entry point for the bacteria. Puncture wounds, like deep, narrow wounds, like those caused by nails or splinters, are ideal for tetanus bacteria, as they create an oxygen-deprived environment where the bacteria thrive. Damaged skin from burns is also vulnerable to tetanus infection. Any break in the skin, no matter how small, can be an entry point for tetanus. Anyone who has not been vaccinated against tetanus is at risk. This includes infants and young children. They are particularly vulnerable as their immune systems are still developing. Older adults' immunity from tetanus shots can decrease over time. People with weakened immune systems, like those with certain medical conditions or taking medications that suppress the immune system, are more susceptible to infections. Tetanus symptoms usually appear within 14 days of infection, but this can vary. They can take as few as 3 days or as long as 21 days to show up, depending on the severity of the infection. Early symptoms can be subtle: jaw cramping, which is often overlooked. This is often the first sign and why tetanus is commonly referred to as lockjaw. Stiffness in the neck muscles is another early indicator. You might find it hard to turn your head. Difficulty swallowing is also common. It might feel like something is stuck in your throat, making it hard to eat or drink. As the illness progresses, more serious symptoms develop, such as muscle spasms and stiffness, which can be quite debilitating. These can be severe and painful, affecting the back, abdomen, and limbs. Fever is another common symptom. Your body temperature will rise. Sweating is also a frequent symptom. You might sweat more than usual. Fast heart rate is another sign. Your heart might race. High blood pressure. This is another sign that your body is under stress, indicating the severity of the infection. Diagnosing tetanus is usually based on a physical exam and your medical history. Your doctor will look for the telltale signs, especially muscle stiffness and spasms. There is no specific test for tetanus. Treating tetanus involves neutralizing the toxin. This is done with an antitoxin injection. Also, cleaning and properly caring for the wound are crucial to prevent further infection. Medications and therapies can help control the painful muscle contractions. Supportive care include breathing support fluids and nutrition. Tetanus is a serious illness, but the good news is that it is preventable. Vaccination is the most effective way to protect yourself and your loved ones. The DTaP vaccine is a key player in this protection. This vaccine protects against 3 dangerous diseases: diphtheria, tetanus, and pertussis, also known as whooping cough. Children receive a series of 5 doses, usually at 2, 4, 6, and 15 to 18 months, and again at 4 to 6 years old. The Tdap vaccine is also important. This booster shot is given at age 11 to 12, and then every 10 years throughout adulthood. Staying on schedule is vital. It is important to stay up to date on your tetanus booster shots. Mark your calendar and keep track of your vaccination records. In addition to vaccination, proper wound care is crucial. Clean all wounds thoroughly to prevent infection. Use soap and water to wash the wound gently. After cleaning, apply an antiseptic to further protect against bacteria. This helps to kill any bacteria that may be present. Keep the wound covered with a clean bandage. A bandage will help to keep the wound clean and prevent further infection. Change the bandage regularly. Seek medical attention if needed for deep wounds, puncture wounds, or wounds that are not healing properly. Timely medical intervention can make a big difference. While children are particularly vulnerable, adults need protection too. It is important for everyone, regardless of age. Immunity from childhood vaccines can decrease over time, so booster shots are essential to maintain protection. Tetanus bacteria are found everywhere in the environment, not just on rusty objects. They thrive in soil, dust, and manure. Any break in the skin, no matter how small, can be an entry point for the bacteria. Unfortunately, having tetanus does not make you immune. You can still get it again, so vaccination is still crucial. You cannot catch tetanus from another person. It is caused by bacteria entering a wound, not by person-to-person contact. Proper wound care is essential. By understanding the facts about tetanus, we can take the necessary steps to protect ourselves and our loved ones from this serious illness. Stay informed and stay safe. Thanks for watching.